Tamash produced a quick evidence review of pre-cutting, which is I'm very grateful to him for doing. Lots of different names for pre-cutting. Circumferential incision, of course, they're not really the same thing. If you're cutting around the whole thing versus cutting through part of it. Partial or complete pre-cutting, CEMR, CIEMR, that's what we're calling it in Westmead. In terms of adverse events, some studies to show what they're like. Yeah, relatively high maybe, but perforations maybe a little less than ESD, maybe a little more than EMR. I think you have to be careful with it. I think it's the message. In terms of recurrence rates, green line EMR or pre-cut, color is that? Brown line ESD, blue line EMR. So down with the ESD in terms of this. Another study using 20 to 40 millimeter lesions, 25 millimeter snares, or other spiral of 25. Circumferential incision first and then resection. So not what we are doing, right? We are using this technique to open the plane here. And we're still using a 50 millimeter stem. We're doing a piecemeal technique. We're really interested in adverse events here only. Again, not many adverse events in this. Yeah, also quite interesting. And here you see, again, some adverse events, but not many. Some nice pictures of the sort of lesion you might want to apply this to. Small, but you can clearly see very difficult lifting in this point. And then when you apply the circumferential technique, you can get a decent resection here. This looks pretty inflamed, this tissue, to be honest. And a modification with a snare, nice snare tip with a knife almost on the tip of the snare, which gave decent results in comparison with standard EMR. And then the only RCT in the field, this study where en-bloc resection was achieved more often than EMR. The other outcomes pretty similar. Bleeding more common with pre-cut, and I think this is what we see with the, I presume these were all en bloc, no, not all. But also interesting that it seems to increase bleeding during the procedure, not after the procedure, and during the procedure. Yeah, I mean, it's for sure a risk factor for causing perforation, either on the time when you incise or when you put the snare and you cut. But of course, we're not talking about that. We are simply talking about when you make an incision to access the submucosal plane more easily.